Now, President Trump is now refusing to reopen the Affordable Care Act enrollment period for the uninsured people. Now, this is happening under a current health crisis where millions of people are uninsured. They just lost their jobs. And so, and their employer sponsored insurance. And so maybe opening that up would be a way for some of these people to be able to get insurance. An anonymous White House official told Politico on Tuesday night that the Trump administration is not reopening healthcare.gov for an enrollment period, which disregards the urgent pleas from advocacy groups and more than 100 members of Congress. So that same official says, look, we're going to explore other options, right? But we're not going to do that. We're not going to open up the ACA. Oh, really? Okay. So we're in the middle of experiencing a health and economic crisis, and Trump's saying, nope, not going to do it. Why? Why would he not do that? I mean, look, that would make sense to say, and also would probably help insurance companies. And let's be honest with you. I thought insurance companies were his friends, were his donors. Apparently, not good enough for Donald Trump. So now, the other option, there's no details about what other option is there. And to be honest, if it's not Medicare for all, then I don't really care what your other option is because it's not going to do a goddamn thing. I doubt we're even going to see a plan whatsoever because look, health insurance companies, look, they want to make a profit, right? And so they're going to continue to charge people for treatment, even though the administration did get them to waive some copays and deductibles for testing. Well, okay, you're going to do that for testing, but you're not going to do that for treatment, even though Donald Trump said otherwise. And don't get confused by the press conferences by Donald Trump, who says, "Oh, don't worry, all this will be taken care of. It'll be free. Don't worry about it. The testing and the treatment is going to be free." No, it's not. Health insurance companies did not agree to that whatsoever. In fact, the treatment can cost, even with insurance, thousands of dollars, right? For someone who's uninsured, expect to pay, if you survive, if you're lucky enough, $20,000 to $70,000. That's money that you owe for getting treated for COVID-19. And so that problem, by the way, is not solved by opening up ACA enrollment. Okay. But still, the Democrats are calling on Donald Trump to open it up because they're saying, well, look, lives are at stake, right? We got to do this. In fact, Representative Bill Pascrell says, quote, in the middle of a pandemic that could kill hundreds of thousands, Trump and his toadies are deliberately blocking Americans from buying healthcare. There's this fanatical cruelty that will kill people. Huffington Post Jeff Young wrote late on Tuesday, quote, the people living in the 38 states that use healthcare.gov will likely remain uninsured, leaving them potentially exposed to tens of thousands of dollars in cost if they get sick and need medical treatment. The negative consequences of this active refusal to offer help to vulnerable Americans is obvious. This isn't just an outrageous decision, but it's also a deadly one. And so, look, the reason he's doing this, of course, is because Donald Trump hates the ACA. And the reason that he hates the ACA is because of Obama. And keep it real, Donald Trump is literally that petty. So he's like, we're not going to do the ACA, right? I'm not going to open it up. Well, he's also not going to do Medicare for all either. And so I don't know what his plan is going to be. It's probably, again, not going to be a plan. He's going to do literally nothing. But here's the thing. The Trump administration, because they hate Obamacare so much, because Obama, they've tried to restrict eligibility, right? They tried to kill the law nationally. In fact, the administration is currently backing a lawsuit that, if successful, would completely overturn the ACA. Now, that's why it's ridiculous to even try to defend the ACA at this point and not push for a Medicare for all system. But hey, man, as far as Trump is concerned, if that happens and millions of people lose their insurance, he's going to call that a win because I own the black guy. Our president's a sociopath. But again, here's the real issue, right? From a progressive perspective. Even if you open up the ACA enrollment period, there are millions of people who will not be able to afford insurance. So what's really the point of that? I mean, there are millions of people that lost their jobs, 3.3 million people in a week, and unemployment is expected to go up above 30% by the Federal Reserve. That's, again, according to Federal Reserve projections. So you have all these people that are losing their jobs and losing their health care and their source of income. And right now, yes, there are unemployment benefits, but there are people who also don't qualify for those unemployment benefits and don't qualify for the one-time $1,200 stimulus check. What are they going to do? They're not going to have insurance. Of course, a lot of those people likely didn't have insurance to begin with. And so they've already been effed, and they're going to continue to be screwed over because we don't have universal health care, since we don't have Medicare for all. And so it even gets worse, right? Because insurance companies plan on having a gigantic rate increase. According to an analysis by Covered California, insurance companies could raise premiums by more than 40% next year. And so you will have employers, ones that are actually left, either dropping coverage or increasing the out-of-pocket costs for employees, passing it down to the employees. And so, look, I know it's next year, but let's be honest. This is not something that we're going to be recovering from, or that we're going to be recovered from by next year. We're going to still be recovering. And there's still going to be millions of people that are out of work. There's still going to be a lot of businesses that have closed because of this. And there's going to be millions without health insurance. And so what is opening up the ACA actually going to do? It's not really going to do anything. Yes, it is a step. But in reality, what we really need to do, at the very, very, very least, is make sure all CV-19 testing and treatment is free. Trump can do that. He can do that. And then what we need to do is get to working on pushing our politicians to pass Medicare for all. Now is the time to push for Medicare for all. There is no better time. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.